Welcome to today's podcast on Advanced Trauma Life Support (ATLS), specifically designed for medical doctors and surgeons. We'll cover a comprehensive range of questions and answers to help you better understand this vital course. This podcast was prepared by Dr. Atef Ahmed. But before we start, please do not forget to subscribe to our YouTube channel #1 Doctor. Like and share this podcast and follow us on all social media accounts. The links are below the podcast. Let's get started. Section 1, Introduction to ATLS. What is the purpose of the Advanced Trauma Life Support (ATLS) course?
The ATLS course aims to equip medical professionals with the essential skills and knowledge to manage acute trauma cases effectively. It focuses on a systematic approach to trauma care, ensuring that life-threatening injuries are identified and treated promptly to improve patient outcomes.
Who is eligible to take the ATLS course?
The ATLS course is primarily designed for medical doctors, surgeons, emergency physicians, and other healthcare providers involved in trauma care. It is also suitable for advanced practice providers such as nurse practitioners and physician assistants who manage trauma patients.
How is the ATLS course structured?
The ATLS course is structured into a series of lectures, skill stations, and practical assessments. It includes didactic sessions on trauma management principles, hands-on practice in simulated scenarios, and testing to ensure proficiency in trauma care skills.
What is the duration of the ATLS course?
The ATLS course typically spans 2 days, involving a combination of theoretical learning and practical skill development. Some variations may exist depending on the training center and specific course format.
What certification is provided upon completion of the ATLS course?
A 5 upon successful completion, participants receive an ATLS provider certification, which is valid for 4 years. This certification is recognized globally as a standard of excellence in trauma care.
Section 2, Initial Assessment and Management. What are the primary components of the initial assessment in ATLS?
The initial assessment in ATLS consists of the primary survey, secondary survey, and definitive care planning. The primary survey focuses on identifying and managing life-threatening conditions, while the secondary survey involves a detailed head-to-toe examination and history taking.
What does the primary survey in ATLS involve?
The primary survey follows the ABCD approach: airway with cervical spine protection, breathing and ventilation, circulation with hemorrhage control, disability neurological status, and exposure environmental control. This systematic approach ensures that critical conditions are addressed promptly.
Why is cervical spine protection crucial during the initial assessment?
Cervical spine protection is vital to prevent further injury in patients with potential spinal cord damage. It involves immobilizing the neck and using appropriate techniques to secure the airway without causing additional harm.
How is airway patency assessed and managed in trauma patients?
Airway patency is assessed by checking for obstructions, listening for breath sounds, and observing chest movements. Management may involve suctioning, using airway adjuncts like oropharyngeal or nasopharyngeal airways, and performing advanced interventions such as intubation if necessary.
What are the key considerations for managing breathing and ventilation in trauma patients?
Ensuring adequate breathing and ventilation involves assessing respiratory rate, effort, and oxygen saturation. Management may include administering supplemental oxygen, providing positive pressure ventilation, and addressing conditions like pneumothorax or hemothorax.
Section 3, Circulation and Hemorrhage Control. How is circulation assessed in trauma patients?
Circulation is assessed by evaluating pulse quality, heart rate, blood pressure, and capillary refill. The presence of external bleeding is also checked. Rapid identification and control of hemorrhage are crucial to prevent shock.
What are the principles of hemorrhage control in ATLS?
Hemorrhage control involves direct pressure, use of tourniquets, and hemostatic agents for external bleeding. For internal bleeding, rapid surgical intervention or interventional radiology may be required to control the source of hemorrhage.
What are the signs and symptoms of shock in trauma patients?
Signs and symptoms of shock include hypotension, tachycardia, altered mental status, cool and clammy skin, and decreased urine output. Recognizing these signs early is critical for timely intervention.
How is shock managed in the context of ATLS?
Shock management includes fluid resuscitation with crystalloids, blood transfusions if needed, and addressing the underlying cause of shock, such as hemorrhage. Monitoring and supporting organ function are also essential components of shock management.
What is the role of advanced monitoring in trauma care?
Advanced monitoring, such as continuous electrocardiography, pulse oximetry, and invasive hemodynamic monitoring, helps assess the patient's condition in real time. It guides therapeutic decisions and allows for early detection of complications.
Section 4, Neurological Assessment. How is the neurological status assessed during the primary survey?
The neurological status is assessed using the APU scale: alert, voice, pain, unresponsive, and the Glasgow Coma Scale (GCS). These tools help determine the level of consciousness and identify potential brain injuries.
What are the components of the Glasgow Coma Scale (GCS)?
The GCS consists of 3 components: eye-opening E, verbal response V, and motor response M. Each component is scored individually, and the sum of these scores provides an overall assessment of the patient's neurological status.
Why is the GCS important in trauma assessment?
The GCS is important because it provides a standardized method for assessing and communicating the severity of a patient's neurological impairment. It helps guide management decisions and track changes in the patient's condition over time.
What are the common causes of decreased level of consciousness in trauma patients?
Common causes include traumatic brain injury, hypoxia, hypotension, hypoglycemia, intoxication, and metabolic disturbances. Identifying and addressing these underlying causes is crucial for effective management.
How is traumatic brain injury managed in the context of ATLS?
Management includes maintaining adequate oxygenation and perfusion, controlling intracranial pressure, and preventing secondary brain injury. This may involve intubation, mechanical ventilation, and surgical intervention if necessary.
Section 5, Exposure and Environmental Control. What does exposure and environmental control entail in the primary survey?
Exposure involves completely undressing the patient to perform a thorough examination for hidden injuries. Environmental control ensures the patient is kept warm to prevent hypothermia, which can exacerbate trauma-related complications.
Why is hypothermia a concern in trauma patients?
Hypothermia can lead to coagulopathy, acidosis, and impaired immune function, worsening the patient's condition. Maintaining normothermia is critical to optimize physiological functions and improve outcomes.
How is hypothermia prevented and managed in trauma care?
Hypothermia prevention and management include using warm blankets, heated intravenous fluids, and warm air devices. The patient's environment should be controlled to prevent further heat loss.
What are the signs of internal injuries that may not be immediately apparent?
Signs include abdominal tenderness, distension, flank bruising, decreased bowel sounds, and hematuria. Imaging studies, such as fast-focused assessment with sonography for trauma and CT scans, are often required to diagnose internal injuries.
How is the secondary survey different from the primary survey?
The secondary survey is a more detailed and systematic head-to-toe examination performed after life-threatening conditions have been addressed in the primary survey. It includes a thorough history and physical examination to identify all injuries.
Section 6, Specific Injury Management. What is the approach to managing thoracic trauma in ATLS?
Management involves assessing for life-threatening conditions like tension pneumothorax, open pneumothorax, massive hemothorax, and cardiac tamponade. Interventions include needle decompression, chest tube insertion, and emergency thoracotomy if necessary.
How is abdominal trauma assessed and managed in ATLS?
Assessment includes physical examination, fast ultrasound, and CT scanning. Management depends on the injury severity and may involve non-operative management, interventional radiology, or exploratory laparotomy for significant hemorrhage or organ damage.
What is the role of the FAST exam in trauma care?
The FAST exam is a rapid bedside ultrasound used to detect free fluid in the peritoneal, pericardial, and pleural cavities. It helps identify internal bleeding and guide further management decisions.
How are pelvic fractures managed in trauma patients?
Management includes stabilizing the pelvis with a pelvic binder or external fixation, controlling hemorrhage, and addressing associated injuries. Definitive care may require surgical intervention.
What are the key principles in managing musculoskeletal trauma?
Key principles include immobilizing fractures, assessing neurovascular status, controlling bleeding, and providing pain relief. Open fractures require prompt surgical debridement and antibiotic administration to prevent infection.
Section 7 Pediatric and Geriatric Trauma. What are the unique considerations in pediatric trauma care?
Pediatric patients have different anatomical and physiological characteristics, such as larger head-to-body ratio and more elastic bones. Management involves using age-appropriate equipment and drug dosages, and recognizing that children may compensate for shock longer before decompensating rapidly.
How is the primary survey adapted for pediatric patients?
The primary survey follows the same ABCD approach, but with modifications for pediatric anatomy. Airway management may require smaller equipment, and fluid resuscitation is based on weight 20 ml/kg bolus.
What are common causes of pediatric trauma?
Common causes include motor vehicle accidents, falls, sports injuries, and child abuse. Recognizing non-accidental trauma is crucial for ensuring the child's safety and appropriate intervention.
What are the challenges in managing geriatric trauma patients?
Geriatric patients often have comorbidities, polypharmacy, and decreased physiological reserves. They are at higher risk for complications such as delirium, infections, and poor wound healing. Management requires careful consideration of these factors.
How is the secondary survey adapted for geriatric patients?
The secondary survey involves a thorough assessment of pre-existing conditions, medication review, and evaluation of functional status. Pain management and mobilization strategies must be tailored to their needs.
Section 8 Special Considerations. How is trauma care approached in pregnant patients?
Trauma care in pregnant patients involves managing two patients, the mother and the fetus. Prioritizing maternal resuscitation, monitoring fetal well-being, and considering potential obstetric complications are crucial. Left lateral tilt positioning helps prevent supine hypotensive syndrome.
What are the specific challenges in managing trauma in obese patients?
Obese patients may have difficulties with airway management, vascular access, and imaging. Equipment and techniques may need to be adjusted, and there is an increased risk of complications such as wound infections and thromboembolism.
How are burn injuries managed in the context of ATLS?
Burn management includes assessing the extent and depth of burns, fluid resuscitation using the Parkland formula, pain management, and preventing infections. Airway management is critical in inhalation injuries.
What are the considerations for managing electrical injuries?
Electrical injuries require assessing for entry and exit wounds, cardiac monitoring for arrhythmias, and evaluating for deep tissue damage. Renal function must be monitored due to the risk of myoglobinuria and acute kidney injury.
How is blast trauma managed in ATLS?
Blast trauma involves managing primary blast injuries, barotrauma, secondary injuries, shrapnel, tertiary injuries, impact, and quaternary injuries, burns, inhalation. A multidisciplinary approach is often required.
Section 9 Radiology and Diagnostic Imaging. What is the role of radiology in trauma assessment?
Radiology provides critical information for diagnosing internal injuries. X-rays, CT scans, and ultrasound are commonly used to evaluate the extent of trauma and guide management decisions.
How is the decision to perform a CT scan made in trauma patients?
The decision is based on clinical assessment, mechanism of injury, and findings from the primary and secondary surveys. CT scans provide detailed images of internal injuries and are particularly useful for head, chest, and abdominal trauma.
What is the significance of the PAN scan approach in trauma care?
The PAN scan approach involves performing whole-body CT scanning to quickly identify multiple injuries. It is particularly useful in polite trauma patients but should be balanced with considerations of radiation exposure.
How is ultrasound used in trauma care?
Ultrasound is used for the FAST exam to detect free fluid and guide procedures such as central line placement. It is a rapid, non-invasive, and bedside tool that enhances trauma assessment and management.
What are the limitations of diagnostic imaging in trauma care?
Limitations include the potential for missed injuries, radiation exposure, and the need for patient stability during imaging. Clinical judgment remains essential, and imaging results should be interpreted in the context of the overall clinical picture.
Section 10 Resuscitation and Damage Control Surgery. What are the principles of damage control resuscitation in trauma?
Damage control resuscitation involves a combination of permissive hypotension, hemostatic resuscitation, and rapid surgical control of bleeding. The goal is to stabilize the patient for definitive care while minimizing further physiological derangement.
What is the role of permissive hypertension in trauma resuscitation?
Permissive hypotension aims to maintain a lower blood pressure around 90 mmHg systolic to minimize bleeding until surgical control is achieved. It is contraindicated in patients with traumatic brain injury who require adequate cerebral perfusion.
How is Massive Transfusion Protocol (MTP) implemented in trauma care?
MTP involves the rapid delivery of blood products in a balanced ratio, e.g., 1:1 for red blood cells, plasma, and platelets to manage severe hemorrhage. Early activation and coordination with the blood bank are crucial for its success.
What are the key steps in damage control surgery DCS?
DCS focuses on controlling bleeding and contamination with temporary measures, followed by resuscitation in the ICU and later definitive surgical repair. It involves abbreviated laparotomy, packing, and use of temporary closure techniques.
When is damage control surgery indicated?
DCS is indicated in patients with life-threatening injuries who are at risk of developing the lethal triad of coagulopathy, acidosis, and hypothermia. It is also used when prolonged surgery is not feasible due to the patient's physiological status.
Section 11 Trauma Systems and Team Approach. What is the role of a trauma system in improving patient outcomes?
A trauma system is an organized approach to managing trauma patients that includes pre-hospital care, trauma centers, and rehabilitation services. It ensures timely and coordinated care, leading to improved survival and functional outcomes.
How do trauma centers differ from regular hospitals?
Trauma centers are specialized hospitals with dedicated resources, personnel, and protocols for managing severe trauma. They are classified into levels IV based on their capabilities, with level I centers providing the highest level of care.
What is the importance of a multidisciplinary team in trauma care?
A multidisciplinary team approach ensures comprehensive care by involving specialists from various fields such as surgery, emergency medicine, anesthesia, radiology, and critical care. Collaboration and communication are key to effective trauma management.
How is team performance optimized during trauma resuscitation?
Team performance is optimized through clear leadership, defined roles, effective communication, and regular training in simulation scenarios. Checklists and protocols help ensure that critical steps are not missed.
What is the role of trauma registries in improving trauma care?
Trauma registries collect data on trauma patients, including demographics, injury details, treatments, and outcomes. Analyzing this data helps identify trends, improve protocols, and guide research and policy decisions.
Section 12 Pre-hospital care and transport. What are the key principles of pre-hospital trauma care?
Key principles include ensuring scene safety, performing rapid assessment and stabilization, maintaining airway and breathing, controlling hemorrhage, and transporting the patient to an appropriate trauma center promptly.
How is the decision made regarding the mode of transport for trauma patients?
The decision depends on factors such as the patient's condition, distance to the trauma center, terrain, and weather conditions. Options include ground ambulance, air ambulance, helicopter, or fixed wing, and in some cases, naval transport.
What is the role of pre-hospital intubation in trauma care?
Pre-hospital intubation is performed to secure the airway in patients with severe head injuries, compromised airways, or respiratory failure. It requires skilled providers and appropriate equipment to minimize complications.
How is hemorrhage controlled in the pre-hospital setting?
Hemorrhage control in the pre-hospital setting involves direct pressure, use of tourniquets for limb injuries, hemostatic dressings, and rapid transport to a facility where definitive surgical control can be achieved.
What are the challenges in providing pre-hospital care in remote or austere environments?
Challenges include limited resources, difficult terrain, adverse weather conditions, and prolonged transport times. Providers must be trained in wilderness medicine and have access to portable equipment and communication tools.
Section 13. Ethical and legal considerations. What are the ethical considerations in trauma care?
Ethical considerations include respecting patient autonomy, obtaining informed consent, managing end-of-life decisions, and ensuring equitable access to care. Providers must balance the urgency of trauma care with these ethical principles.
How is informed consent obtained in trauma situations?
Informed consent in trauma situations can be challenging due to the patient's condition. When possible, consent should be obtained from the patient or their legal representative. In emergencies, implied consent is assumed if the patient is unable to provide it.
What are the legal implications of performing emergency procedures without consent?
Performing emergency procedures without consent is legally permissible under the doctrine of implied consent, where it is assumed that a reasonable person would consent to life-saving interventions. Documentation and communication with family members are important.
How are advance directives and DNR orders handled in trauma care?
Advance directives and DNR orders should be respected if known. In the absence of such directives, life-saving measures are initiated, and efforts are made to obtain information about the patient's wishes as soon as possible.
What is the role of the medical examiner or coroner in trauma cases?
The medical examiner or coroner investigates deaths resulting from trauma to determine the cause and manner of death. This may involve scene investigation, autopsy, and review of medical records. Collaboration with forensic experts is often required.
Section 14. Rehabilitation and long-term care. What is the importance of rehabilitation in trauma care?
Rehabilitation is crucial for maximizing functional recovery and quality of life after trauma. It involves physical therapy, occupational therapy, psychological support, and vocational training to help patients regain independence.
How is the rehabilitation process initiated in trauma patients?
Rehabilitation begins early in the hospital setting, with interventions aimed at preventing complications such as muscle wasting and joint stiffness. A multidisciplinary team assesses the patient's needs and develops an individualized rehabilitation plan.
What are common complications that can occur during the rehabilitation phase?
68 common complications include chronic pain, infections, pressure ulcers, deep vein thrombosis, contractures, and psychological issues such as PTSD and depression. Monitoring and addressing these complications are essential for successful rehabilitation.
How is pain managed in the rehabilitation phase of trauma care?
Pain management involves a multimodal approach, including medications, physical therapy, nerve blocks, and psychological support. The goal is to control pain effectively while minimizing the use of opioids.
What is the role of family and caregivers in the rehabilitation process?
Family and caregivers play a vital role in providing support, motivation, and assistance with daily activities. Education and involvement of caregivers in the rehabilitation process help ensure continuity of care and better outcomes.
Section 15. Trauma research and quality improvement. What are the key areas of research in trauma care?
The key areas include improving trauma resuscitation techniques, understanding the pathophysiology of trauma-induced coagulopathy, developing better diagnostic tools, optimizing rehabilitation strategies, and investigating outcomes in specific patient populations.
How is clinical research conducted in the trauma setting?
Clinical research in trauma involves observational studies, randomized controlled trials, and registries. Ethical considerations, such as obtaining informed consent and ensuring patient safety, are paramount in conducting research in this setting.
What are the challenges of conducting research in trauma care?
Challenges include the acute and unpredictable nature of trauma, difficulty obtaining informed consent, variability in injury patterns, and the need for rapid data collection and analysis. Collaborative multi-center studies can help overcome some of these challenges.
How is quality improvement QI integrated into trauma care?
QI involves systematic efforts to improve patient outcomes through process optimization, adherence to clinical guidelines, and continuous monitoring of performance metrics. Regular review of trauma cases and outcomes helps identify areas for improvement.
What is the role of morbidity and mortality conferences in trauma care?
Conferences provide a forum for discussing adverse events and complications in a non-punitive manner. The goal is to learn from these events, identify root causes, and implement changes to prevent recurrence and improve patient care.
Section 16 Special Topics in Trauma. What are the challenges in managing trauma during mass casualty incidents?
Mass casualty incidents require rapid triage, efficient resource allocation, and coordination among multiple agencies. Establishing command and control structures, communication systems, and contingency plans are critical for effective response.
How is trauma care adapted for military settings?
Military trauma care involves managing combat-related injuries, often in austere environments. Techniques such as damage control resuscitation, use of tourniquets, and forward surgical teams are adapted to meet the unique challenges of battlefield trauma.
What are the considerations for managing trauma in patients with coagulopathies?
Managing trauma in patients with coagulopathies involves addressing the underlying condition, using blood products and clotting factors judiciously, and monitoring coagulation status closely. Anticipating and managing bleeding complications is crucial.
How are psychological aspects of trauma addressed in patient care?
Psychological aspects are addressed through early identification of mental health issues, providing counseling and support, and involving mental health professionals. Addressing PTSD, anxiety, and depression is important for holistic trauma care.
What is the impact of trauma on healthcare systems and society?
Trauma has a significant impact on healthcare systems due to the need for acute care, long-term rehabilitation, and associated costs. It also affects society through loss of productivity, long-term disability, and the emotional burden on families and communities.
Section 17 Case Studies and Practical Applications. How can case studies be used to enhance learning in ATLS?
Case studies provide real-life scenarios that help apply theoretical knowledge to practical situations. They encourage critical thinking, problem-solving, and discussion of different management approaches, enhancing learning and retention.
What are the benefits of simulation-based training in trauma care?
Simulation-based training allows for hands-on practice in a controlled environment, enabling participants to develop and refine skills without risk to patients. It enhances teamwork, communication, and preparedness for real-life trauma situations.
How are trauma scenarios used in ATLS training?
Trauma scenarios involve simulated patients or mannequins with specific injuries. Participants perform assessments and interventions in real time, receiving feedback from instructors. This helps bridge the gap between theory and practice.
What are the key takeaways from a successful trauma case management?
Key takeaways include the importance of a systematic approach ABCD, timely interventions, effective teamwork, and continuous monitoring. Learning from each case helps improve future trauma care and outcomes.
How can feedback from trauma cases be used for continuous improvement?
Feedback from trauma cases, including successes and challenges, is used to identify areas for improvement. Regular debriefings, audits, and adherence to updated guidelines contribute to ongoing quality improvement in trauma care.
Section 18 Future Directions in Trauma Care. What are the emerging trends in trauma care?
Emerging trends include advances in pre-hospital care, use of telemedicine for remote consultations, development of new hemostatic agents, and improvements in surgical techniques. Personalized medicine and genomics are also becoming increasingly relevant.
How is technology influencing the future of trauma care?
Technology is influencing trauma care through innovations such as portable ultrasound devices, point-of-care diagnostics, telehealth platforms, and advanced imaging techniques. Robotics and artificial intelligence are also being explored for trauma applications.
What is the role of artificial intelligence AI in trauma care?
AI has the potential to enhance trauma care by improving diagnostic accuracy, predicting outcomes, optimizing resource allocation, and assisting in decision-making processes. It can analyze large datasets to identify patterns and trends in trauma management.
How is trauma care being adapted for global health settings?
In global health settings, trauma care is adapted to address resource limitations, varying infrastructure, and cultural differences. Strategies include training local healthcare providers, developing low-cost technologies, and implementing context-specific protocols.
What are the priorities for future research in trauma care?
Priorities include understanding the mechanisms of trauma-induced coagulopathy, improving trauma resuscitation strategies, developing better diagnostic tools, optimizing rehabilitation methods, and addressing the long-term impacts of trauma on patients and society.
Section 19 Personal Experiences and Insights. What personal qualities are essential for healthcare providers in trauma care?
Essential qualities include resilience, the ability to remain calm under pressure, strong communication skills, teamwork, and a commitment to continuous learning. Empathy and compassion are also crucial for providing holistic care to trauma patients.
How can healthcare providers cope with the stress of managing trauma cases?
Coping strategies include seeking support from colleagues, participating in debriefings, practicing self-care, and engaging in activities that promote mental and physical well-being. Professional counseling may also be beneficial for managing stress.
What motivates healthcare providers to work in trauma care?
Motivations include the desire to save lives, the challenge and variety of trauma cases, the opportunity to make a significant impact, and the sense of fulfillment that comes from helping patients recover from critical injuries.
How do personal experiences shape the approach to trauma care?
Personal experiences, including previous encounters with trauma patients, professional training, and mentorship, shape a provider's approach to trauma care. These experiences contribute to clinical judgment, empathy, and decision-making skills.
What are some memorable cases that highlight the impact of effective trauma care?
Memorable cases often involve dramatic recoveries, successful team efforts, and overcoming significant challenges. These cases highlight the importance of preparedness, skill, and collaboration in achieving positive outcomes.
Section 20 Final Thoughts and Resources. What are the key resources for staying updated in trauma care?
Key resources include medical journals such as the Journal of Trauma and Acute Care Surgery, attending conferences like the Trauma, Critical Care Acute Care Surgery Conference, participating in continuing medical education CME courses, joining professional organizations like the American College of Surgeons ACS, and utilizing online platforms like UpToDate and PubMed for the latest research and guidelines.
How important is it for trauma care providers to engage in lifelong learning?
Lifelong learning is critical in trauma care due to the rapidly evolving nature of medical knowledge and technology. Engaging in continuous education ensures that providers stay current with best practices, improve their skills, and ultimately deliver the highest quality of care to their patients.
What role do mentorship and networking play in a trauma care provider's career?
Mentorship and networking provide invaluable support, guidance, and opportunities for professional growth. Mentors offer insights and advice based on experience, while networking with peers and experts helps providers stay informed, collaborate on research, and share best practices.
What advice would you give to new graduates entering the field of trauma care?
New graduates should prioritize gaining a solid foundation in basic principles, seek out mentorship, engage in continuous learning, and develop strong communication and teamwork skills. They should also embrace opportunities for hands-on experience and stay resilient in the face of challenging cases.
What are the most rewarding aspects of working in trauma care?
The most rewarding aspects include the ability to make a significant impact on patients' lives, witnessing dramatic recoveries, the variety and challenge of cases, and the sense of fulfillment from working as part of a dedicated and skilled team. Trauma care providers often find great satisfaction in knowing they are making a difference in critical moments.
Conclusion. That wraps up our comprehensive discussion on Advanced Trauma Life Support (ATLS) for medical doctors and surgeons. We've covered everything from the primary and secondary surveys to special considerations, radiology, resuscitation, ethical issues, rehabilitation, and future directions in trauma care.
Thank you for having me. It's been a pleasure discussing such an important and dynamic field. I hope our listeners found the information valuable and insightful.
Absolutely. Trauma care is a critical area of medicine, and staying updated and informed is essential for providing the best patient care. For our listeners, if you have any questions or want to learn more, don't hesitate to reach out to professional organizations or continue your education through courses and conferences.
Remember, effective trauma care relies on a systematic approach, continuous learning, and collaboration. Stay dedicated, stay informed, and most importantly, stay compassionate.
Do not forget to subscribe to our YouTube channel #1 Doctor, share and like the podcast, join our social media accounts. The links below the podcast. Get exclusive offers to our bookstore at books.atef.net or our bookstore at Amazon. Just search for Dr. Atef Ahmed on Amazon. Thank you for tuning in, and until next time, stay safe and keep learning. Goodbye, and best wishes to all our listeners in their journey in trauma care. With best wishes of Dr. Atef Ahmed.